भी मैं दे रही हूँ सर, जो हमने लास्ट
हाँ
सेशन करा
हाँ
था।
हाँ श्योर।
So, very good afternoon, everyone. Thank you for joining in today's session on cancer awareness. It's my pleasure to introduce Dr. Subham Jain. He's a senior director of surgical oncology at Fortis Hospital, Vasant Kunj. So, over to you, Dr. Jain, and thank you for joining in.
Thank you, Poonam, for such a kind introduction. A brief about myself before I start on the session for today. I'm a surgical oncologist. I'm working as a senior director at Fortis Cancer Institute, Vasant Kunj. I have been practicing oncology and the surgical treatment for cancers for more than a decade now. There has been a lot of transition that I have seen in the last 1 decade. And what I have realized in my clinical practice is that there is actually no other alternative to beating cancer than to identifying it early. The sooner we are able to detect and diagnose a person with cancer, the better are the chances for an individual's cure or treatment from cancer. The treatment in those cases is very short, it is very effective. So it is very, really very important that we start talking about cancers. Many of the people that I meet uh, do consider themselves to be immune to cancer somehow. But actually, the fact is that nobody amongst us is immune to cancer. It can happen to men and women alike. It can happen at any age. It can happen to people who do not have anybody else in the family affected with cancer. It can happen to people who do not smoke or abuse tobacco or alcohol in any way. So there is actually no replacement than to be knowing about cancers and their common symptoms. So if I were to play this video of what exactly cancer is, now cancer, as we all know, is an unregulated cell division that starts happening within our body. So normally cells divide at an expected rate, which is normal, and this division progresses in a controlled manner. There is always a check balance on the cells that are growing, and if it is not needed, it gets curbed. But with cancer cell division, this progression is at a very rapid rate. Because this is unchecked and unregulated, in comparison to a normal cell, you can see on the screen that the cell number is increasing very rapidly. And not just that, it makes a lump of cells. So from the slide that you are seeing, you can appreciate that on the left hand side, the cells which are normal and streamlined, rather on the right hand side, the clump of cells that forms a lump at any organ of origin that there may be. Not just that, it starts affecting the functioning of the organ. It affects the functioning of the other normal cells around it. That is the second characteristic of cancer. The third is that these cells have the potential to spread and start affecting the other organ functions of the body, because of which it can become life threatening. The fourth potential that we see and discuss in cancers is despite treatment, despite removing it surgically, there can always be a recurrence of cancer, which means that some of these cells skipped the original site of origin or were missed in the treatment, in the initial treatment, and then they present later with a recurrence of cancer. So that is why cancers are such a deadly disease. Now, the second question that comes to mind is what are the common symptoms of cancer? Now, in the initial stages, the symptoms of cancer are related to the organ of origin or whichever organ they are affecting or originating from. So, because there are multiple organs in the body, the symptoms also can be very varied. And even vague symptoms such as headache, change in voice, breathing difficulty, pain, abdominal pain, any lump that's happening, muscle aches, all these could be varied presentations of various cancers in the body. And virtually every organ in the body can develop cancer. So that is why there is no one common set of symptoms that, when noticed, should alarm the patient to a diagnosis, but it should be An ongoing understanding that if there is any abnormality which is not responding to treatment or not improving despite medication, one should be alert to the possibility of it being due to cancer. The second reason that we need to talk about cancers is that I personally feel that we fear things in proportion to our ignorance of them. The more ignorant I am, or the more less known an entity it is to me, the more I fear. So, the answer to anybody's anxiety or fears of cancer is to talk about them. The more we understand them, the better empowered we are, the more informed we are, the better decisions we can take, not just for ourselves, for others also. And also, what we are gradually seeing is that the incidence of cancer or the cases of cancers that we see around us are gradually on the rise. More and more people are getting affected with cancer. We hear it more and more often. I do get a lot of queries of why is the cancer around us increasing? Is it because of our dietary habits? Is it because of our lifestyle changes? None of them is scientifically proven, but it is a fact that we are actually seeing more and more cancers around us. And this trend is expected to continue for the next 2 or 3 decades at least. So that is why ignorance for cancers is not an option. If we are to talk of the common cancers that we see around us, amongst Indian women, breast cancers and cancers of the intestine are the most common cancers that are identified. And in men, tobacco related cancers that affect the mouth or lung and prostate cancers are the most common cancers. Now, I will be taking these cancers, the common warning symptoms they have, the risk factors that an individual have, and how we can identify these cancers early one by one. So the most common cancer that affects Indians is the breast cancer, and I'll start with the presentation for breast cancer. Now, risk factors for breast cancers are classified into non-modifiable and modifiable. By that, I mean something that an individual can take charge of or change in their lifestyle habits, or something that cannot be changed and just needs to be understood. Now, speaking of the non-modifiable risk factors, factors that we cannot change in our lives is being a woman. So, being a woman is it itself seen as a risk factor for developing cancer. Second is, as we grow older, the chances of developing cancer increases. Now, because age is something we cannot control, that is why it is seen as a non-modifiable risk factors. Similarly, a lady's menstrual history of the age at which she starts her menstrual period, which is called menarche, or the age at which a lady develops menopause. These are also not something that an individual can control, nor is a personal history of cancer or a family history of cancer or somebody in the family being affected by cancer. Now, these are seen as certain non modifiable risk factors that we cannot control. But if we have these in our life, then we need to understand that we stand at a average risk of developing cancer. Now, then there are certain modifiable risk factors. Modifiable risk factors are that we can change. Physical inactivity is something that we can change. Being overweight or obesity, especially in the postmenopausal age group, is seen as a risk factor for developing for developing breast cancer. Having first pregnancy after the age of 35 years, not breastfeeding, never having a full pregnancy, these also increase a lady's chance of developing breast cancer. Now, once we've identified the risk factors in and around us, we need to understand how can we detect a breast cancer early. So if any lady presents with a new lump that she's noticed in the breast or in the armpit, especially if it is slowly increasing in size, one should definitely see a doctor to evaluate what is the nature of the lump in the breast. A word of caution here, not all lumps in the breast are supposed to be cancerous, but all lumps in the breast should be evaluated to rule out any cancer. Similarly, if there is any recent change in the appearance or symmetry of either the breast or nipple, or there is a nipple discharge, especially if it is bloody or one-sided, these are symptoms that must definitely be evaluated by an oncologist. As I was saying about the modifiable risk factors, the protective factors akin to that are once we start addressing them. So, for the physical inactivity, which was a risk factor, if we do regular exercises, that can be a protective factor. For people who are obese, especially in the postmenopausal age group, if they strive towards maintaining a healthy weight, that can protect you against breast cancer. Similarly, early pregnancy, breastfeeding, avoiding or limiting alcohol intake can definitely safeguard a woman against breast cancer. Not just that, an activity called a breast self examination, which is an examination by a lady herself once a month, can definitely help the woman identify any problem early. In people who are genetically predisposed to developing cancers, uh, prophylactic use of certain drugs or prophylactic surgeries may help in reducing the risk of cancer, but these need to be discussed with an oncologist before being initiated. The breast self examination that I was talking about is basically an examination of the breast by the lady herself, preferably done once a month after the menstrual periods are over. The lady can do this in a shower in front of a mirror where she is to inspect or look at her breasts for any recent change in appearance or any asymmetry. The lady can also touch and feel various areas of the breast around the nipple and in different quadrants to notice any abnormality which may be recent in nature. If she finds any problem, she is encouraged to see a doctor for opinion. Medically speaking, in addition to the breast self examination, there are certain methods of identifying breast cancers early. Clinical breast examination, if done once every 2 years, definitely has an impact in saving lives, which is basically seeing a doctor for a breast examination once every 2 years. In addition to that, getting a mammography done once every 1 to 2 years, especially in the women of age 50 to 74 years, is known to have a definitive protective advantage wherein we can identify the cancers early. Breast MRI and ultrasound of the breast are recommended in certain specific clinical indications and can have an impact in identifying the lesions early. What I am saying is from evidence, which is through trials that have been conducted uh, at the Tata Memorial Hospital in Bombay, wherein they actually practiced clinical breast examination and cancer awareness sessions amongst women. And they did prove that regular screening can reduce the chances of death due to cancers by up to one third. So that is the kind of impact that a simple intervention, such as talking about cancers, being alert towards them, and simple examinations can have. Now, mammogram is basically an X-ray of the breast, wherein the breast is compressed between two plates and an X-ray image is taken. So that is why it is recommended to avoid having mammograms when a person is due or just a week before it, because the breast at that time may be swollen or tender. Similarly, it is recommended to avoid wearing deodorants, powder, or perfume when going for a mammogram because these may show up as artifacts on the X-ray. Uh, these are certain prevention tips for a mammogram. The next common cancer that I would like to talk about would be the cervical cancers. Now, cervical cancers still not so long ago used to be the most common cancers that affected Indian women. But because of improvements in hygiene, awareness to cervical cancers, common symptoms and signs, and HPV vaccination, this has now been pushed to the second most common cancers that we see affecting Indian women. The risk factor is usually seen as an infection by a virus called the human papilloma virus. Now, this virus affects or infects many individuals, but usually is a self-limited type of an infection wherein it gets cleared by the body by themselves. But in certain cases where the body is unable to clear it on its own, in those instances, it may lead to development of cervical cancer. Smoking, having multiple sexual partners, giving birth to three or more children are seen as other risk factors. Because it affects the cervix, which is essentially the opening or the mouth of the uterus, these present with warning symptoms associated with unpleasant or unusual vaginal discharge or any abnormal vaginal bleeding. Patients may also have heavier or longer menstrual periods or discomfort or pain during intercourse at times. Now, because majority of these cancers are related to the HPV virus, Administering a vaccine against the HPV virus, especially before a woman becomes sexually active, uh, preferably before the age of 15 years, has a significant protective advantage given to the individual. The vaccination can be considered from 15 to 26 years and even up to 40 years in certain instances, but it is best to consult an oncologist for the same. The second protective factor could be the use of condoms during intercourse, which can help an individual fight against cervical cancer or the HPV infection. Because these cancers develop as a result of infection over long periods of time, screening for HPV DNA or doing a pap smear test, especially between the ages of 25 to 65 years, helps us in understanding the changes that are happening in the body much sooner than before a cancer develops. So that is why it is highly recommended for individuals to get the pap testing done every 3 to 5 years till they are 65 years of age. Again, the studies from Tata Memorial Hospital have proven that such regular interventions do have an impact on the lives lost due to cervical cancer, and up to one third of the lives can be saved, which would have otherwise been lost due to cervical cancers. The pap smears obviously should not be planned immediately after intercourse. It is actually advisable not to have intercourse using tampons, douching, or rinsing the vagina till up to 2 days or 3 days before the test that is being scheduled. And it should not be scheduled when a lady is already bleeding. There is an initiative by the WHO, which is called the 90-70-90, for the cervical cancer elimination by the year 2030, which is adopted globally, which strives to achieve 90% vaccination for eligible girls, 70% coverage of screening modalities, and 90% coverage for women identified and diagnosed with cervical cancer, which can probably help us in eliminating deaths due to cervical cancer by the year 2030. Along the similar lines, if we were to see the uterine or the endometrial cancers, the risk factors here again are the age group, being overweight or eating high fat diet, or in certain cases having a familial or personal history of breast or colon cancer. The warning symptoms are similar of unusual vaginal discharge or spotting or bleeding, especially after menopause, or if a lady notices bleeding after intercourse. Though there are no standard screening strategies which are recommended to identify uterine cancers early, pap smears or endovaginal or transvaginal ultrasounds may help in early detection. It is to note that there is no significant blood test that can help in identifying the endometrial cancers, as is wrongly believed by some. Then there are the cancers that affect the ovary in a woman. Now, again, the risk factors are similar. That is the postmenopausal age group, more than 60 years of age, family history of ovarian or other cancers, breast or colon cancers. And in some cases, obesity or being overweight is also seen as a risk factor. The other thing is the warning symptoms, because the symptoms of ovarian cancers are very vague, of abdominal pain, back pain, bloating, pelvic pressure. Usually, we identify these cancers at advanced stages. There are no major protective factors, but in certain cases, getting the oophorectomy done, uh, if the uterus is being addressed for uh, menorrhagia or surgically being removed at that time. So that is called a risk reducing salpingo-oophorectomy that can be considered if a person is having a high risk of developing ovarian cancer. Or in some cases, breastfeeding or use of contraceptive pills is seen as protective against ovarian cancers. There is no standard routine screening test, but ultrasound of the abdomen, some basic blood tests may help in identifying these cancers early. If I were to talk of the next big chunk of cancers, which are the tobacco related cancers. Now, tobacco related cancers are tobacco is abused either in a smokeless form, which is the khani, gutka, pan masala that affects only the mouth or the oral cavity, or the other could be the smoking form, active passive, which affects both the mouth and the lungs. So tobacco abuse not just affects these two organs, but it has a devastating impact on the body with regards to our general health and many other cancers also. In addition to that, cancers of the throat, certain virus infections such as HPV are known to be causing these cancers also. And in certain cases, ill-fitting dentures or sharp teeth can also predispose an individual to developing cancers. Common warning symptoms for cancers of the mouth could be a non-healing ulcer or thickening in the mouth, any difficulty in chewing, opening, or moving the jaws, any white or reddish patches that are observed on the gums, tonsils, tongue, inner lining of the mouth. Many times people start complaining of a recent loosening of tooth or dentures or pain or swelling in the jaw that they notice. Sometimes the patients may have a lump or mass in the neck, or sometimes they may just have a difficulty in swallowing or change in voice. So, if there are any of these symptoms and a person is a tobacco abuser, they should definitely consult an oncologist to understand the reason for their symptoms. Even if they are not having any symptoms, but a person is a heavy tobacco abuser, similar to breast, they should do a multi self examination through regular dental checkups or examining the mouth themselves at least once a month. The next are the lung cancers. As I said, the risk factors, the most important modifiable risk factor is smoking. There are certain other industrial exposures to asbestos through occupations which involve working in mines, mills, textile plants, shipyards, which passively or actively expose an individual to asbestos, which further increases the risk of developing lung cancers. In addition to that, having a personal previous history of radiation therapy or living in an area which has a lot of pollutants, PM 2.5 and PM 10, can also increase an individual's risk of developing lung cancers. Now, the symptoms here can be very vague. Most commonly, we see any smoker whose cough is persisting or worsening over 2 to 3 weeks, or an individual coughing up blood or rust-colored sputum that is known or identified as a warning symptom for lung cancers. Occasionally, patients may complain of chest pain, which gets worsened on deep breathing, coughing, or laughing. People may be complaining of hoarseness or recent change in voice. And then in advanced stages, there are certain other symptoms of shortness of breath, loss of appetite, recurrent chest infections. The way to identify these cancers early would be using a CT scan, which is done once every year, especially in the high risk individuals who are current smokers or have a smoking history of more than 20 pack years. People who are 50 to 80 years of age and fairly good health are encouraged to get these CT scans done. Then the most common cancer that affects Indian men after the tobacco related cancers are the prostate cancers. Now, prostate cancers also affect the uh, elderly, and there are certain instances of a genetic preponderance to them. The most common warning symptoms being problem in passing urine, such as a slowing or weakening of the urinary stream, or need to pass urine more and more often, especially at night, which disturbs the sleep. Uh, at few instances, patient may complain of passage of blood in urine or in semen. But most commonly, we fail to identify these cancers early because they are so silent. And majority of patients present with complaints of pain in hips, backs, back, chest, that is the ribs, when this cancer from prostate has spread to the bones. There are screening modalities that are recommended, especially to men more than 50 years of age who are otherwise in good health, who can get it screened through a simple blood test called a prostate specific antigen, or an examination of the prostate clinically or with an ultrasound, which needs to be repeated every 1 to 2 years, especially if the gentleman is in otherwise reasonably good health. Then I'd like to also talk about the cancers that affect the food passage. The food passage is clinically divided into the upper GI tract and the lower GI tract. Patients having problems in the upper GI tract usually manifest with problems more related to difficulty in swallowing food. They may complain of vomiting, they may complain of reflux. These patients may also complain of difficulty in swallowing. They would need gradually sips of water, or they would change their dietary habits so that they are able to digest the food. Those are the common warning symptoms that these patients have. They may complain of bleeding at times in their vomitus, and in generally have unexplained loss of appetite and weight loss. Now, the screening strategy for individuals known to be at high risk for developing cancers of the upper GI tract or having any of these symptoms, the first step is to get an upper GI endoscopy. Similarly, the cancers of the lower GI tract, it is seen in generally elderly people who are having a personal or family history of polyps or colon cancers, and people who are physically inactive, slightly overweight and obese. The warning symptoms are related more to constipation, diarrhea, or change in bowel habits. These people may start complaining of passage of blood in stools or abdominal pain, unintended weight loss. Again, the screening strategy here employs seeing the large intestine through a camera, which is called a colonoscopy. These tests can be done starting from the age of 45 years up to 75 years of age and need to be repeated once in 10 years. An alternate could be checking the stools that we pass for any blood, which is called occult blood, which can be done every 3 to 4 years. Last, I would like to talk of the liver cancers, which are usually seen in patients who abuse alcohol or are cirrhotics for other reason. It is also seen in patients who have hepatitis B or hepatitis C infections, because the liver maintains a lot of back end processes in the body. The symptoms are not very clear. Patients usually have vague symptoms of unexplained weight loss, bloating, nausea, vomiting. They may complain of abdominal pain, and at very advanced stages, they may also notice jaundice. The protective factors are timely treatment of viral hepatitis and vaccination against hepatitis B, especially in medical professions. People who are suffering from cirrhosis or have these viral infections are considered at high risk for developing cancers and should be screened every 6 months with the use of blood tests and ultrasound of abdomen to identify these cancers early. So that was my presentation on cancers, the common signs, symptoms that we must know. In case there are any questions, I'd be happy to answer. And thank you. Poonam, in case there are any questions, I'd be happy to take those.
Yes, sir. Putting on chat box.
So I have a question from Mr. Kumud. Food and daily habits to avoid cancers. So a very good question and a very commonly asked question. Uh, in our habits, we should involve definitely avoiding abuse of tobacco and alcohol in all forms. Tobacco abuse affects not just us, but if we are smoking, we also involuntarily affect our peers, people around us, our loved ones, through passive smoking that they end up doing just being in our surroundings. So definitely avoiding tobacco and alcohol is one way for a healthy living. The second is having a lot of green leafy vegetables in our diet. We should reduce on the red meat or high calorie foods that we consume. We should restrict on that. The third way is having a active life by doing exercises regularly. About half an hour of moderate intensity exercises every day are good. Or we can have a target of maybe weekly exercises of about 150 minutes of high intensity exercises. Now, those are seen to be protective against cancers. Not just that, I would probably say we should involve the screening strategies and make a part of our lifestyle, wherein we by default get ourselves checked for cancers every 1 to 2 years, which can help us identify cancers early. So these are some of the tips that I feel that we should be following to avoid cancers or to avoid a delayed diagnosis of cancer. The second question I have is from Mr. Prasad Dai Thankar. What are the tests to diagnose cancer and what age these are recommended? So, as I said, the cancers can affect various organs of the body. So, there is no single test that we can do to identify cancers early. And there is no one age to recommend these tests. It is imperative or important to meet an oncologist who would understand your lifestyle patterns. The risk of cancer varies depending on your gender, depending on your age, depending on your smoking status, depending on your lifestyle choices, depending on your family history. But as a thumb rule, what can be recommended is the common cancers can be evaluated. So any woman should be screening herself for breast cancers every 1 to 2 years, starting from the age 50 to 74, 80 years of age, with the use of mammogram. Any gentleman who's smoking should get themselves screened for oral cancers by a simple examination. Any gentleman who's a heavy smoker between the age of 50 to 80 years should undergo a CT scan of the chest to rule out any lung cancers. Everybody between the ages of 45 to 75 should get a colonoscopy done uh, between the ages every 10 years between the ages of 45 to 80. So these are some common tests. Now, unfortunately, screening for cancers is basically looking for a needle in haystack. So it may seem worthless to many people of getting so many tests done to identify a problem which is not even there. But the advantage is actually in identifying a cancer early. It can really make an impact to an individual if we are able to identify a cancer early because the chances of cure are much better. So I would sincerely request and urge everybody to consider screening tests for common cancers at least, if they've not done till now, for themselves and for their family members, because it is a part of a healthy living where we can identify a problem sooner rather than later, where the choices of treatment are much more within our control. The next question is from Isha Agarwal. If there are any early signs, if there are any signs for early detection of cancer. Now, Isha, again, as I said, at the earlier stage, the cancers affect the organ functioning. So these symptoms can be very vague. Uh, in the beginning, nothing generalized as a set of symptoms, but a thumb rule could be any lump. A thumb rule could be an ABC. Now, with A, I'm saying any lump or any non-healing sore that has developed and it is not improving, or the lump which is gradually increasing in size. So that's A, any lump or ulcer. B is any bleeding that's happening from anywhere, which is abnormal. It could be bleeding in vomitus, bleeding in stools, bleeding after a lady's periods have stopped. Uh, so bleeding from anywhere could be the next common early warning sign. C is something that has changed in the body and has become a constant. So if there is a change in the voice, which is not improving, or there is a change in the bowel habits, or if there is a change in a dietary pattern, or if there is a cough which is continuously there, which is not improving. So any change that has happened and it's not reverting. So this is again an early warning symptom. So A, B, and C, and we should take care of these. And if we do notice and understand any of this, we should definitely see a doctor. There is absolutely no harm in getting 1 or 2 tests done, which may come as normal, and we are okay with that. We are not saying that every time we do a so screening is directed to people who are normal. It's not for patients. The idea of screening is that I'm otherwise healthy. I have a good life expectancy. It should not be that there is cancer, which I find out at a later point. So a healthy individual gets screened for cancers. The next question is from Mr. Ashish. He has a lipoma kind of thing and would like to know in depth around this. So, Mr. Ashish, I would strongly encourage you to seek a consultation. It would be wrong for us to generalize it or the condition that you're having and without even examining, guiding you on that. So I would strongly recommend you see a doctor. Uh, Jyoti is asking if cancers are hereditary and which type of cancers are hereditary, who is more affected, son or daughter, what precautions should be taken. So, Jyoti, cancers are definitely hereditary in nature. Not all cancers are hereditary. Of all the cancers that we see, about 10% cases are because of genetic reasons, which means that if I were to see 10 patients of cancers, any one of them may be having a genetic reason for the cancer that's developing. That is where science is. We don't know all the reasons and very specifically all the reasons of why one particular individual got cancer, but that is where we are now. There is no single type of cancer which is definitely genetically related or which cannot happen genetically. It can be passed on to a boy or a girl equally from their parents. So there is no differentiation from that. And there is actually no precaution that you can take when it comes to genetic mutations. It is more of an early awareness where if you know that there is a genetic preponderance, knowing your family history, you can be more alert, you can be more aware of the development of cancer. You can preemptively or proactively be looking for them, that if it is there, you take steps so that you can safeguard yourself. And one of the modalities, probably extreme, would be an example of, let's say, Angelina Jolie, who got her breasts removed because she had a very strong family history and genetic reason to developing breast cancer. Now, I'm not saying that's the only approach to dealing with it or the most appropriate approach. It depends on individual to individual. She would have counseled her oncologist or doctors at that point of time and made a decision for a surgery. For somebody else, it could be just keeping an eye open for that, getting the tests done. So, understanding that there is a family history, that there is a risk of developing cancers because of genetic mutations, that is important. And based on that, taking a decision is an individual call that varies massively from one individual to the other. Dharmendra is asking, what are the symptoms of mouth cancer and is leukoplakia a symptom of pre-cancer or cancer? So, thank you for the question, Dharmendra. Leukoplakia is a whitish patch that develops in the mouth, usually over the gums or the inner lining of the mouth. It is a precancerous lesion, which means it is not a cancer it's in itself. It wouldn't be life-threatening immediately. It wouldn't spread. But if the leukoplakia is left alone, it is left to be in the body, over a few years, it will get converted into cancer. That is why it is called a precancerous lesion. If we were to treat it either medically or surgically, the results are good. Usually, surgically leukoplakic patches are removed and there is no follow-on treatment that is required for these patients. Other than that, the common symptoms of mouth cancer I've already discussed. I'll repeat again, would be any ulcer that is developed in the mouth and is not healing, any recent loosening of the teeth, difficulty in moving or opening the jaw, any lump that an individual has noticed in the leg, in the neck, any change in voice, any difficulty in swallowing. These could be some of the common symptoms of cancers, but not short of that, if somebody has abuses tobacco, has sharp teeth, consumes alcohol, consumes tobacco, they should definitely consult an oncologist. They should definitely abstain from tobacco and alcohol, because there is no particular threshold that after so many packets of cigarette or after so many consumptions of alcohol only will an individual be at a high risk of developing cancer. So, Vishnu has asked that people who are working in Delhi, especially having field jobs in polluted environments, how to protect themselves. So, there is really no safeguard actually entirely. At our level, we can try to work indoors as much as possible. We can try to wear the N95 masks, taking all precautions with air purifiers at home and indoor spaces, which can be our best bet. We should definitely pitch on our own in trying to reduce the pollution, whether it is through vehicular emission, whether it is otherwise constructions going on around us. But there is very limited that an individual can do or contribute. The more effective way of dealing with it at an individual level would be use of N95 masks and air purifiers. Okay. So I believe there are no more questions. Thank you so much for the questions, and it was lovely to be talking about cancers, the common awareness in signs and symptoms. Because, as I said in the beginning, I feel that the most effective way of fighting cancers would be through early detection. The more we are able to talk, the more we are able to understand about cancers, the better will be our chances to identifying them early, catching them early, treating them, and saving lives. Thank you so much. And in case you feel the need to consult me, my details are with Poonam. She would definitely share them with you. Thank you so much.